Starting with the name of Allah, who is the most merciful and beneficent. It's me, Dr. Mazhar, and you are watching Neurology Medical Lecture. So, in my previous lecture, I talked about the anatomy and physiology of frontal lobe. So today, I would like to talk about the function and the anatomy of parietal lobe. So, as we know that the parietal lobe is present between the frontal and occipital lobe. So this is the frontal lobe and this is the occipital lobe. So it is between the frontal and occipital lobe. So parietal lobe is the one which is responsible for taking the sensory information from the periphery. So that lobe is actually dominant forward for the sensory information. So actually in the normal person, right-handed person, dominant lobe will be left. If someone is right-handed, so his dominant lobe will be left parietal lobe. But if someone is left-handed, still 70% his dominant lobe will be left. So major physiology of the parietal lobe is that the parietal lobe is responsible for sensation like touch, sensation, pain, temperature, pressure and vibration. So these all sensations go from periphery to the parietal lobe. Then parietal lobe communicate with frontal lobe or temporal lobe. Then final movement will be occur. So it take the sensation. For example, if you touch something, so it's that touch sensation go from the finger to the brain. In which part? In the parietal lobe. Then as action, that parietal lobe is then communicate with frontal lobe. So as a result, frontal lobe do any action. And also parietal lobe is responsible for memory of memory. So if someone develop parietal lobe stroke or parietal lobe ischemia, so that patient can develop memory problem like dementia. Also parietal lobe is also communicate with frontal lobe and occipital lobe. So occipital lobe is function is what? Visualization. But the optic tract can travel from that, crossing the that lobe, and then it enters the occipital lobe. So parietal lobe is also responsible for coordination of visual and auditory and somatosensory stimuli and spatial and body awareness, because temporal lobe is a sensory part. So it knows that what's the condition of the bone, what's the condition of tendon, what's the condition of muscle. So it is just like a judgment. So it judges the proper position of every system. So parietal lobe actually it communicate with temporal lobe as well. So temporal lobe, there is a speech area, and frontal lobe there is also speech area. You know, every lobe is depending on the other lobe for its function. It doesn't mean that only the parietal lobe is doing action alone. No, when a parietal lobe want to do any action, so it communicate with frontal lobe, then frontal lobe communicate with temporal lobe. So this is how the parietal lobe is communicate with every lobe. So I hope you understand what I am saying. So parietal lobe is responsible for the sensation, somatosensory, somato means skin, and it also responsible for sensation which coming from the bones as well. So all the sensation go from where? From the ascending tract to the parietal lobe, not descending. Why? Because descending tract come from where? Frontal lobe. So ascending tract go from the posterior column of the spinal cord, and it go into the parietal lobe, and then it communicate with frontal lobe. Then from the descending tract, from the anterior column, it go down and do any action. So that's all for about parietal lobe. So I hope you understand. So inshallah in my next video I will further talk about temporal lobe, especially because temporal lobe is very important as well. So I will talk about temporal lobe in next my video. Okay, thank you so much.